The ratings for Live with Kelly and Mark dipped earlier this year when Kelly Ripa was absent. Her husband and co-host, Mark Consuelos, missed a few shows earlier this month for an unexplained reason. Now that he's back, he opened up about acting inappropriately during his health issues that kept him off the show. Keep reading to find out what he did. ABC has had a shortage of hosts for their talk shows this month due to health issues. Joy Behar missed nearly a week of The View after an injury. Kelly Ripa welcomed guest hosts to live amid her husband's unexplained absence. Her husband of nearly 30 years, Mark Consuelos, became her official co-host in 2023 after Ryan Seacrest left, but he was back on the air on Monday's episode. Kelly Ripa started a discussion about a new acronym sweeping the internet. She described FOFO as the fear of finding out and related it to medical issues. There are things you can nip in the bud, and instead, you let it get to the place where it's beyond repair, Kelly Ripa warned. In response, her husband confessed to finally having his first colonoscopy recently at the age of 54. According to the American Cancer Society, men should start having the procedures done around the age of 45. The colonoscopy seemingly was done around the time Mark Consuelos missed several episodes of Live, though he didn't confirm that was the reason for his absence. "I'm 54 and I hadn't had one yet, so that's late," the talk show host admitted. He shared details about the routine health test. Mark Consuelos said that he tried to fight the anesthesia to stay awake longer but couldn't. "Afterwards, I remember sitting there, and I remember I didn't want to say anything silly. I didn't want to say anything silly in the recovery room, but I felt very rested," he said. But that was tough after he noticed a pretty nurse. "That's when things went sideways. I see my nurse is this young girl, and she was adorable. She was really, really cute, and I thought she'd be amazing for my son Joaquin. But I shut my mouth," Mark Consuelos said. He added, "I kept it shut. I was gonna ask her if she was single. I didn't do it. I was gonna ask her how old she was. I didn't do it. I didn't say anything." Kelly Ripa revealed that he told her all about it when he came home after the procedure. "You came home, and you were like, there was a nurse. I tried to set her up with Joaquin, but then I thought I shouldn't say anything. So, I kept my mouth shut. Aren't you proud of me? And I was like, oh, Lord. He's still high." She told the audience that it would have been inappropriate for her husband to try to set up their son with his nurse. The couple shares 3 children, Michael, 28, Lola, 24, and Joaquin, 22. Their youngest son graduated from the University of Michigan earlier this year and moved back to Manhattan, New York, while figuring out his next move. Tell us in the comments if you agree it would have been inappropriate for Mark Consuelos to try to set his nurse up with his son. The surgery was a success. Mark's results were great. Kelly joked that he had the colon of a much younger man, the ultimate relief. But the biggest drama unfolded in the recovery room. Mark recounted the experience himself, admitting he was trying desperately to hang on to consciousness, terrified of saying something embarrassing. A fear we all share when under general anesthesia. But the self-control vanished when he saw his nurse, a young, adorable woman. And this is where the inappropriate behavior comes in. Mark confessed that his drugged mind went straight into dad mode. He decided this nurse would be perfect for their youngest son, Joaquin. He had to clamp his mouth shut to stop himself from asking, "Are you single? How old are you? Do you like wrestling?" Kelly Ripa, recounting the story, couldn't help but laugh, calling the potential questions very inappropriate. Imagine the scene. A handsome, high-profile celebrity, half asleep, trying to set up his son with his recovery nurse. But here is the surprising, inspirational twist. This moment was not a source of marital friction. It was a moment of pure vulnerability and utter relief. Kelly knew that the inappropriate behavior was just the residual chaos of a man who had faced his fear and come out safe. She saw past the silly words and saw her husband, safe, goofy, and still thinking about his family. This is the unexpected gift of a major health scare. It strips away the ego and reveals the person you married, flaws and all. But the question remains, can a relationship built on decades of public scrutiny and high pressure survive the smaller, daily tests of attention and affection? Kelly and Mark recently put their entire marriage to a simple, viral test, and the results were far more revealing than any